The other day, the German government released figures on serious adverse reactions to the COVID vaccines. By serious, they mean serious enough to put you in the hospital. They said it was 1 in 5,000 doses. Now, careful here, that's not people, but doses. So if you've signed up for a 5th jab, well, you can do the arithmetic on that. The Berliner Zeitung newspaper calculates that 1 out of every 1,667 boosted Germans has experienced serious side effects. That'd normally be enough to get a drug pulled, but apparently not with these particular ones. Here with us now to discuss this and the rest of the latest in the COVID vaccine debacle is the former NHS pathologist, Dr. Clare Craig. Clare, is something shifting in the vaccine narrative?
I think it might be beginning to. I think we've seen people try to reposition themselves a bit, and nothing dramatic yet apart from that you've just described from the German Health Ministry. But, you know, it has to start somewhere, so I'm optimistic. And
if anything, they are actually underestimating it. I've seen figures that suggest it could be as high as 1 in 300 doses.
Well, in fact, Germany's own data suggests that. So what the 1 in 5,000 per dose data is from the equivalent of our yellow card system. So it's doctors who've reported that they're concerned about an association. And now some people will claim that those will be coincidences, but actually what we've seen historically is that tends to underestimate what the problem is. Although there may be some coincidences in there as well. But what they did in Germany is they carried out surveys as well. So as well as having the reporting system, they were actively seeking what was happening to cohorts of people. And one of their surveys was for 550,000 people. So massive, you know, 500,000 people. After their vaccines, they'd found out what happened to them. And after Pfizer and Moderna, 1 in 500 had a serious adverse event. And after AstraZeneca, it was 1 in 142. Now, in that number, you will also have some coincidences because you're just asking everybody in the whole population, you know, have you had something happen to you in that period of time? So the number's likely to be somewhere between 1 in 5,000 and 1 in 500. And the actual trial data, the Pfizer trial data, had 15 more people who were vaccinated who had a serious adverse event, which works out at 1 in 1,400. So these people were either hospitalized or they had a life-changing event or a life-threatening event. So these are just the very serious tip of the iceberg stories.
All these people, like Whitty and Vallance and Professor Pants down at Imperial College, they must know this stuff, yet we are still giving them. They got knighthoods and damehoods in the Platinum Jubilee Honours. The Queen has just given the NHS the George Cross for the vaccine rollout. That's a very select club. Why is the government still presenting the vaccines as this fairy tale?
So it's not just our government, the others are too, and the Germans were almost patting themselves on the back about how well they'd measured this without any sort of consideration about the people behind the numbers. And I think the situation we're in is that these people in these positions of authority have convinced themselves that they've saved millions of lives. And they've done that partly through modelling from, guess where, Imperial. But they've also done it partly by looking very closely at the data and deciding that there are fewer deaths per case in people who are vaccinated. But when you take a step back, if you look at the big picture, you say, well, let's look first of all at how many deaths have accumulated over time. So you'll see a gradient across the world of the sort of COVID death tally, and it's going up before the vaccines. When the vaccines arrive, that gradient should drop because it should have had an impact, but the gradient carries on steady as a rock throughout. If you look at the number of deaths per reported case, those are very, very high at the beginning. And they were high because we weren't capturing all the cases because we were only testing really in hospitals and care homes. And then as we tested more and more, it fell and became a perfectly flat horizontal line in every continent. And that horizontal line continued steady as a rock right through vaccines being introduced. And then there's a stepwise drop when Omicron arrives.
Right.
Because you see in the data when Omicron arrives, no impact from the vaccines. And so what you see also comparing, say, neighbouring regions. So you can look at Israel compared to Palestine. Now, that's quite an interesting case study because actually people mix and work in Israel from Palestine. And the vaccination rates are very different between Israel and Palestine. And prior to vaccination, the death trajectory and the case trajectory were bang on equal. Then vaccines come along, the cases rocket in Israel, and the deaths are the same in Israel and Palestine. So if you've got more cases but the same number of deaths, you can get the impression that the deaths per case has fallen for the vaccinated. Yeah,
that actual difference between Israel, it's not often that the Palestinians reveal themselves to be, because Israel is vaxxed, boosted. And those happy, sappy Palestinians, they're not doing anything in Gaza and the West Bank on that. Are we ever going to get out of this? I mean, they're now the new health. The guy, Sajid Javid, who refused to come on this show, he's gone. He's history. He's toast. No one even remembers him. There's some new health secretary. The first thing he does is he says, sign up for your booster now.
It's difficult, isn't it? But I think actually the general public are voting with their feet. The numbers of people turning up for the next dose and the next dose gets lower and lower. The number of people who put their children forward is thankfully very, very low, much lower than in similar countries to us.
Oh no! Oh, this is the horrible High Court decision about jabbing children. The great thing is that parents have somehow discerned that. I think it's actually that this would be difficult to live with if you did this and it went wrong.
Well, I mean, the real thing with children is that they don't need it. You don't need to. There doesn't need to be any discussion about it being a problem.
No.
They don't need it. So why are they pushing so hard for children to have it? It makes no sense.
No, absolutely no scientific justification at all. Thank you very much for that, Claire.